Concern is mounting over the rise in COVID-19 cases in the Eastern Cape. According to health authorities, at least 50 to 55% of the country's daily COVID-19 cases are from that province. Meanwhile, Health Minister Dr. Zweli Mkhize recently visited the Eastern Cape to address the resurgence of infections. One of the main concerns which have been raised is the strain that healthcare workers have been placed under. For more on this, I'm joined now by Dr. Thobile Mbengashe, who is a COVID-19 special advisor to the Eastern Cape Premier. Good evening, and thank you so much for your time tonight. There are concerns that have been raised as numbers continue to surge in the province where you are about the fatigue and the levels of exhaustion that healthcare workers are faced with. How are you dealing with that?
No, thank you very much. And I really welcome the visit by the Minister. And I think the Minister has been very supportive of the Eastern Cape. It is true that the numbers in the Eastern Cape have increased quite substantially. And we're really finding that because of the fast increase, the health services in the Nelson Mandela plus Sarah Bachman has been under severe strain. But the Minister was very clear that in terms of the hospital facilities and the beds that are available, those we have, and the ICU facilities, those are available. The key thing is really the human resource, the fatigue from the staff, and in that way he has asked that we should get about 20 additional Cuban doctors who will join the department, and then the department itself has been really recruiting additional nurses to support those that are actually in the service.
Dr. Mbengashe, there have been others that have said that the system is so strained that others that are hoping to get beds in hospitals are not able to. Can you paint a picture for us of just how challenging the situation is on the ground?
Yeah, no, that's important. I think one of the key issues why the Minister came was this whole fear that there were no beds. What we have found is that there are sufficient beds for our patients. At Nelson Mandela on the BWB, there are about 1,500. In the other hospitals, they've recruited another 300 beds. What was the problem was that in the way how they were managing patients, most of the patients that are still under investigations, they were kept in casualty. The Minister has really assisted the team there just to make sure that we use the rapid response team, we move patients where they're supposed to be, and then manage patients in the ward. Oxygen is available and medication is available, but the key thing is that the number of increases in the Nelson Mandela actually exceed the numbers that we have had even during this time in the first phase. So that did create a strain in that respect.
And when we talk about, of course, the fact that you're saying that there's enough beds, it's just the allocations and how things are being done on the ground. Let's talk then about the workers themselves that are at the forefront of this. We saw a short while ago the Minister paying tribute to the healthcare workers and honoring them that are in the front lines of the fight against COVID-19. But certainly, fatigue is starting to kick in. A lot of them still have anxiety levels about, COVID-19 and whether or not they'll be contracting it, because over 400 of them have died from the virus. What is being done at hospital level to ensure that they're also protected from COVID-19, because Nehau continues to raise concerns around PPE?
Yeah, no, that's very important. I think we all really appreciate the amount of work that's done by the front lines. And again, the issues of the PPE has been one of the big challenges, but this time it was not a problem. The reason why that's not a problem, the Minister has really worked very hard with Nehau to really establish what is called occupation, health and safety teams. These teams have really played a major role in identifying problems early, and they have done jointly. What is also very important in terms of the staffing, it is true that many of our staff did get their infection, and some of them, regretfully, that they've actually passed on. So the idea now is that to enforce the infection prevention control, and I think our staff are much more confident and much more competent in actually managing the service right now. But it always becomes a risk in terms of infection, and we also say that even when they leave the hospital, they should continue acting and making sure that they're wearing the mask and actually making sure that they're creating social distances even during their travels.
Now, how is demanding that community health workers be absorbed permanently into the system? Is this something that, the healthcare system can be able to afford?
We are very pleased that there has been conversations between the HAU and the other social partners at national level. These processes are in the bargaining council. The work that has been done has actually been well identified how it's going to be progressing and actually achieving the objective. The key issue is that healthcare workers and health workers are part of the NHI wide-based response team. But there are a number of things that have need to be clarified and resolved. Those have not been resolved, and the parties are working on those matters. And we note that HAU has been part of that, but subsequently there has been some changes in the way how they view the problems. Again, there has been, as you know, that the country at the level is really going under severe strain. There are a lot of discussions about how do we keep the numbers of people in the healthcare sectors, but of course we recognize that the health sector is really a service area, therefore is dependent on people.
All right. Thank you so much for your time tonight. That was Dr. Thobile Mbengashe, who's the COVID-19 Special Advisor to the Eastern Cape Premier, who was giving us a sense of just how things are unfolding in that province.